The Latino community is not always a happy community. As seen on the left side of your screen, they have been faced with a few ups and downs. These things are overcrowded housing space, hard to find jobs, not enough information to do what is needed for work trade, not having a strong voice to get things that is needed for the community. They also have a high number and many health diseases. The three main issues in the Latino community: community health center, a safe place to play, addressing diabetes. In the Santana Ana Health Crusade. In this story, the mapping was that of the young children in the Latino community who didn't have a safe place to play and have fun. The communities have many lots that are clear of land that is just sitting there, not being used. The strengths and challenges that this community has so far is that this community can come together when needed, and that they have a young lady by the name of America Bracho. She is a doctor who knows about the Latino community, and she can speak the language. She also worked in the community for a long time. With her voice, she has made a change in the Latino community. At this time, the community is faced with many Latinos who have diabetes and poor health. Many of the Latinos know very little about how to check for treatment for themselves. There are many young people who have amputation which could be changed if they have a nearby health clinic to help them deal with each case. In other words, getting the word out about this disease which is taking the lives of many. The strengths are the many women who have taken a stand on helping their community, but the biggest is Mrs. America Bracho. With her help, this community can come together and change, and each person is taught how to manage their diabetes, that they teach another community on how to do the same. Communities mobilization efforts. After a survey was done, it showed that they needed to have a diabetes awareness program. This was the biggest disease that is taking over in this Latino community. Finding staff to teach others. Latino community came together, making sure they could have a community center, and that this center will be the start of many more. They had the efforts of America Bracho, who is a trained healthcare person who knows what was going on in her very own Latino community, and that diabetes was taking over her people because of lack of knowledge to treat each other. If I had to help these health issues, to start off before I could do anything, I will address the poverty by making my voice heard to the mayor about coming up with a plan to house these families that are on the streets of Santana Ana. I will also let him or her know that the Latino community plays a big role when it comes to voting. Next is the need for a safe place for the children to play and grow. The community could apply the needs and assets mappings like America said in the video, those that know and who could understand diabetes. They could teach what they know to those that don't. We could keep that going. As for the community representative for the health department, I will see that those that have other disease that they seek to getting help for them. I will also have more community events that involve more health screenings. To continue with the diabetes program, I will continue to make it well known to others that the diabetes program is continued in the homes and community. Health issues continuation. This community with another voice, my voice, and that of the community. We shall let the mayor, city councilman, and the government know that it is the people that help put them into that seat. And if they want us to help them stay, then they need to listen to what the community needs. So we are to protest for better living conditions, more health centers, and more programs to all that need help. I will be at every meeting for the community and every community meeting getting the information for what we need to have a better place to live. As the community representative, in order for this community to continue to be healthy, they need to know more about the family history. That way, we can better understand how we're going to treat them when they come into the health centers. These 4 questions should be asked by your family doctor about when it comes to diabetes and your family health history. According to the CDC, they state these 4 questions should be asked by every family. Knowing your family health history is important. Here are some questions to help you learn more about your family history of diabetes. Does anyone in the family have type 2 diabetes? If so, who? Has anyone in the family been told they have a great chance of developing diabetes? Has anyone in the family been told that they need to lower their weight or increase their physical activity to prevent type 2 diabetes? Did your mother get diabetes when she was pregnant? This is also known as gestational diabetes. If the answer to any of these questions is yes, or you have a mother, father, brother, or sister with type 2 diabetes, you may be at an increased risk for developing type 2 diabetes.